Hello, I'm Yildiz Sethi at Crazy Normal for better health and well-being in promoting better ways of working with the mind. I'm inspired to dispel myths and lay out facts about your mind and relationships and mental health. And I'd like you to join me in an exploration of what it is to be a crazy normal like me. But do it in your own way so you can be free to be you. Hello everybody, Yildiz Sethi here of Crazy Normal. I have a really exciting guest here today called Dr. Diane Rogers, a social psychologist who researches psychotherapies. And she's doing a particular research that is very close to my heart, which you'll find out about very soon. And over to you, Diane. Can you tell us a little bit about who you are, where you are, and your exciting development?
Thanks for having me, Yildiz. So, as you said, my name is Dr. Diane Rogers, and I'm a social psychologist and a coach and therapist as well. I'm based in Sydney, Australia, and I'm very delighted to announce the approval of my new clinical research study on family constellation therapy in individual sessions. We're looking at, the title of it is, What Good Can One Session Do? We're looking at what impact family constellation therapy has on adults presenting with symptoms of generalized anxiety, depression, and relational issues. So the one session that they will have in family constellation therapy, the session will be with you. You are our participating researcher, which we are so thrilled to have you on board as part of our research team.
Thank you very much.
Yes,
Yeah, so I am the practical psychotherapy person, yes, and Diane is the researcher, yes.
That's right. And the folks who come on board, we're looking for 35 participants, and we will measure their levels of stress and anxiety or depression and their well-being and their relational issues. We will measure that with psychometric tests. So anybody who doesn't know what a psychometric test is, they're just basically little questions that you answer, and they give us an idea of what your levels of stress are, what your levels of anxiety are, or whether you're moving into areas of depression. Also, your state of well-being, how you feel in the world. And with all of us, those levels of stress, anxiety, depression, and well-being, they shift over time depending on what's happening in our lives. For example, if we've experienced the death of a loved one, our stress levels may go through the roof, and we may not even be aware of it because we are used to, we're used to just going through our lives and going, oh, I feel a little stressed right now. But this is a way of measuring, well, what does that stress level look like? So, for example, your job or your family situation has changed. In any case, those are the psychometric tests that we're using. And then we're having people, we're interviewing people to help them formulate the question that they would actually like to look at in therapy with you. They don't have to tell me in the interview what they would like to look at, but I ask them specific questions that they can answer in a more direct way. It helps them to hone down what they're wanting to work on so that the session with you can be much more effective. Then we're going to be asking them after the session, well, what was it like for you? And what has shifted over time? And then we're also at the same time measuring those stress, remeasuring those stress, anxiety, and depression levels to see, well, what are the measurements involved here? So they might say in their interview that they feel a certain way, but then the measurement will look at, well, how does that track with what they're saying? What are the actual numbers involved there? So it's very in-depth, and people can benefit from it by having an opportunity to reflect on their therapeutic session, which doesn't often happen. Therapy happens in the rooms, and then people go away and they think about things later, but they don't always get to understand what's happened in therapy in real time, and that's what this is.
Very exciting. Okay, so in terms of this research and you're asking for participants, they won't have to pay, right?
That's correct.
The session will be in person online.
With you, that's
With me,
correct.
yes,
So what
okay.
we're asking for participants who qualify, so 18 years old, living in Australia, and
18 years old minimum.
yes, a minimum of 18, yes, minimum of 18 years old, living in Australia, and so presenting with a relationship problem, or if they feel particularly stressed or anxious or depressed, these are the candidates that we're looking for.
Okay, fabulous.
And it could be one or all of those categories.
That's right. So if you're listening to this, it could be you, it could be your partner, it could be a family member, it could be a friend, right?
Yes.
Okay.
Or it could be a person who is a therapist or a counselor themselves.
Who's never actually experienced.
That's exactly right. Or, they're looking for some kind of, relief for their own issue.
Yeah.
Maybe they're so busy in their own practice, they don't often get to see another therapist,
yes.
Or they don't see their supervisor in the same way.
So why the need for this study, Diane?
Well, that's interesting that you ask, and this goes right to your most recent book, Yildiz, that the state of mental health in Australia is not necessarily improving, right? So the Australian government is pouring more and more money into mental health. However, the question is, are we getting any better? There was a book written years ago. It was called something about psychology, 100 years of psychology, and we're not getting any better. And it more or less, we all know in many places in the world there is a mental health crisis. But are the psychotherapies of today, are the counseling modalities that we're using today, are they effective? And there are many research studies that show that cognitive behavioral therapy does create some level of change. It's about 60%, 45 to 60%. So more than half of people aren't seeing effective change, put it that way. So the government in Australia is paying for to 12 sessions, and measurable change comes between 16 and 20. And many people experience a few sessions and they're not necessarily going back. So are we getting the change that the government is paying for? So that's one of the issues. The other issue is that 8.5 million Australians experience some level of mental illness at some point in their lives. At any given time, at least 1 in 10 will experience a mental health crisis. So that's a personal breaking point. So you look around your circles at work, you look around your circles of friends, and at least each year, 1 in 10 people will have some kind of a mental health crisis. And that doesn't mean they'll be landing in the hospital, but that means that their stress, anxiety, or depression levels will be extremely severe. In the last year alone, in Australia, 4.3 million people were living with anxiety, depression, or another mental health condition. Australia has one of the highest rates of antidepressant use in the world. Over 3.3 million people are on medication currently in Australia, with nearly 45.6 million mental health prescriptions written last year. And that's almost twice as many prescriptions as there are people in the country. So we are talking about, massive levels of, public health crisis in Australia. The reason this research is relevant is because we need to re-examine the way psychotherapy is conducted in Australia and make sure that alternative therapies are looked at as much as cognitive behavioral therapies or talk therapies are used. So perhaps alternative psychotherapies could be a companion to some of these cognitive behavioral therapies, and then we might get some greater efficacy, or by that I mean impact. We might get seeing some better results faster.
Okay. And looking at my own book, Let's Take the Crap Out of Psychotherapy, was very much about this idea of my podcast, that, Crazy Normal for Better Mental Health and Well-Being. From a family constellation perspective, getting depressed or anxious or having relational issues is actually part of the crazy normal that we all live through. And sometimes medicalizing it or labeling it or medicating it is not necessarily the best thing, right? And even managing symptoms, yes, it's good to manage symptoms, of course, but how much better would it be to manage them, not have to manage them, to actually make them, integrate them, make them much better, you know, so we're not needing all that help. And this is my contribution here with the family constellation as the practitioner, that often people who do take part in family constellations experience a much better rate of mental well-being and all the rest of it, and also better relationships. So all of that is there. So yeah, definitely, I believe this research is absolutely necessary, because up till now, the major group of modalities that are researched are the medical model modalities only, and hardly ever is it looked outside the box at something else, which might, or according to the study, might not prove to be beneficial. Now, of course, I'm a facilitator of family constellations, so you could say I'm biased, yes, but Diane is a professional researcher. Dr. Diane is a professional researcher. So it's like, I'm not going to be looking at the results. She's going to be looking at the results. She's going to be interviewing them after the session. And if they say it was a load of rubbish and didn't help at all, they'll tell us straight, right? So in that sense, I am not monitoring the results or doing the write-up. Dr. Diane is. So you know, we're hopefully covering both bases, you know. Diana is the researcher, I'm not, so she can do a great job there. And I've been doing what I'm doing for quite a while, so I can do my bit here. And so it's about opening the net, I believe, of mental health and not having it only be the medical model. Now, even better for me would be the medical model, including things like family constellations. I mean, you know, CBT has its place, of course it does. But then so does mindfulness meditation now, and so does a few other things that have been brought into the medical model. Let's make this way of working also an alternative that could be paid by the government, but would hopefully give better results or good results, making it a worthwhile investment. Yeah.
Absolutely, 100%. And I think one of the things, you know, the goal of therapy should not be to further entrench people in their stories of trauma and victimization. And unfortunately, that has been a lot of the pathway of psychotherapy and counseling for the last 40 years. We've been, you know, wanting to be with people opening up to their stories, you know, what's happened to them. And that's all well and good. And it is important for people to get things off their chest and not hold them. But that isn't necessary, as you said, shifting them out of that blame, the shame. It's not shifting them out of where the trauma lives in their bodies. It's important to legitimize people's feelings and validate them, yes, but not keep them stuck in their labels and injustices. It doesn't help them heal and find agency, and it doesn't help them move beyond their wounds. Whereas I think family constellation does a great job of helping depersonalize a lot of the issues that people face. You know, people take them on board from a very young age. Oh, this is my fault. This is my fault. And traditional therapies aren't necessarily shifting them radically outside that role of, no, this is what was happening for someone else, actually not you. And you've taken that on, and that's now in your psyche, and you're operating out of an old story. So, you know, unfortunately, that, you know, ultimately talk therapy makes victims who make great customers, I guess, repeat customers, which is a terrible way of breaking it down, but that's effectively what it does. If you know that you can have somebody consistently coming for 12 sessions, that's money in the therapist's pocket. And I believe family constellations doesn't operate like that. We look at either a single session or a very few sessions to address one deep issue and move that client forward in their lives. Not move them on, but move them forward. It's really important, and it's cost effective as well.
And I guess the other part to this, why family constellations? In my work over the last 25 years, I've come to realize that there are two basic areas of the mind or the mind-body connection that we need to look at. And one is the systemic, which is family constellations, the disturbances and patterns that we carry with and for our family system, right? So we carry lots of wonderful stuff from our family system: love, connection, resilience, experiences, and that's all really positive. But you also carry a lot of the disturbances and traumas that people could not process in those times. And so a child can be born with a generational pattern, disturbance, or trauma, right? Even from birth. And that plays out in their life often as disconnection, exclusion, depression, anxiety, difficult relationship patterns as well. So if family constellations was designed specifically to work with what is generational or systemic in us. Now, I know from my own personal experience that when I've been a counsellor since 2000, and I know that counselling or psychotherapy doesn't actually address systemic issues in the way that family constellation does. Talking about it is not it. With family constellation, it's a whole experience, an experiential process. And we do go back into generations, right? That is the difference, really. Psychotherapy, counselling is more present day, here and now stuff, how you're feeling right now. It's not looking at what happened to mom or dad or your great-grandfather in the war, and helping to do a whole stream of energy processing which helps relieve them of having to carry that. So that's the difference really with family constellations, I believe, and general psychotherapy. The other part of our psyche is the personal subconscious mind. And that very much is important because that really does include your personal subconscious mind, things that have happened in this life, in your life. That being bullied, being harassed, being frightened, being scared, being traumatized in your life gets trapped into a different part of the brain, into the amygdala. Whereas the generational disturbance stroke traumas are coming through on the environment of the DNA generationally into the next generation and the next and the next, right? So they're working in different ways and need to be processed in different ways. That's really what I'm saying. Yeah.
Very, very well said. You've summed it up exactly.
That's right. And a family constellation is really about looking at your anxiety or your depression or your relation issue. What else was there, Diane? Have I covered it all, or is
it stress, anxiety, depression, well-being, and relational issues? Yeah.
Okay. So any one of those issues might be your main issue, but then if you're coming to me as a family constellations practitioner, and particularly for this study, we will look at that particular issue in relation to your family system, you in relation to your family system with that issue, and help you to resort and replace things where they need to be so that you don't have to carry it as much or at all, hopefully, right? That's the aim. And so in that way, I've seen many people actually who've been, as you said, I think before, Diane, when we were talking earlier, seeing people who've done lots and lots of therapy, psychotherapies, good, legitimate psychotherapies for 20 years or so, And the issue they presented to 20 years ago hasn't really shifted that much. They've learned to understand it. They've learned to manage it, but it's still present. And so when they do something like family constellations, if it does have its roots in the family system, it will just disappear completely after a session of family constellation. One session only, it might just reduce significantly, or it might go completely. I'm not sure. Yeah. We'll have to see what the study says. Yeah.
Well, that's right. And we're not issuing a cure. We're not saying this is a cure. We're looking as what can be accomplished in one session.
Yeah.
And it's certainly sometimes multiple sessions are necessary, but we just want to know exactly what this therapy does in a single individual session. It's been studied, I'd say roughly 16 to 20 studies that in the 30 years that this has been practiced, there's only, as I said, roughly around 20 studies that have been published on family constellation therapy. The majority of the research has come out of Europe, and it's mainly been done in group.
Yes.
And not looked at individually. Recently, some researchers from Portugal have published some quite interesting findings with good efficacy. That means they got some, 88% improvement after 7.5 sessions in anxiety and depression and stress levels. So that's a pretty great result over 7 sessions. So that's almost half of what we're seeing in cognitive behavioral therapy studies by comparison. What hasn't been studied is what can one session do?
Yes.
How are people experiencing this differently than standard psychotherapy?
That's right. And because family constellations works with body-based feelings, emotions, and also the energy. We talk about energy a lot in family constellations. How safe is it? How do people feel? How are they after the session? All these things are probably things that people might be curious about, and it'd be really good to see a study like this giving the facts about how people felt. Was it okay to jump into a deep issue like this in the beginning of a one session? Most psychotherapies and counselling would start with lots of prior sessions before we start delving into something really deep, right? But the family constellation process doesn't just help people open up to what's happening. It's also putting you through an experiential process where you're pretty much integrated or mostly integrated by the end of the session as well. So it's not like, I'm going to open you up and then 60 minutes go, oh, sorry, click, off you go out into the world. No, we will make sure that you are properly closed up again, if you like, so that you're safe to go out into the world and you're feeling okay. Of course, how you're really feeling will go with Diane, of course. And, when she does her post session interviews with you. And that's what you haven't said, Diane. How long does this whole process last for people?
Thank you for asking. The study timeline requires a commitment of 7 to 8 hours over the course of 16 weeks. So it's essentially 4 months from the time that they're brought on board to the time that we have our last interview and measurement. It's not really requiring anybody it's just a matter of setting up some interviews. There will be 2 interviews, and they're relatively brief, anywhere from 30 minutes to 50 minutes beforehand, and then questionnaires, and the questionnaires take about 20 to 30 minutes to complete, and it's all online, so you'll be sent links. You can do them in your leisure, and we will obviously work around your timeline to do the interviews. Interviews will be recorded, but the family constellation session will not be recorded. The recorded interviews get transcribed, and that's where the analysis comes from. So we'll be doing a deep dive in the analysis and then also analyzing the results of the stress and anxiety measurements. And then after the family constellations session, we do another 2 interviews and 2 measurements. And they're also, and that's a time where you can really reflect on what you got out of the session. We ask what was helpful, what wasn't helpful, what shifts did you see, what shifts did you expect that you didn't see. So we really want to know the honest truth of, well, what was it like for you? If it was wonderful, that's great. But if it was terrible, we want to know, or if it was neutral, did it help you at all? And the answer could be no. It could be yes, absolutely. It could be no, not at all. It made me feel worse. So we're not looking for any specific answers. We're looking for the truth. And that's what good research should do. It should get to the bottom of, well, what is this actually? As I said, the entire scope of the research is all handled online. So from the leisure of your own living room or office or wherever you want to be, it'll be private between you and Yildiz, private between the participant and myself. So we'll get to know each other over the course of time. And then you'll get to find out, well, how did your stress from the beginning, when you arrived at the study, your stress, anxiety, depression levels, how did they shift? Did they go up? Did they go down? So you'll have more than just your own thoughts. You'll have measurements as well.
Okay.
So that you can take that away and see, really what you got out of it. And as Yildiz said before, there's no cost involved. We're just asking for your time.
And I guess, the nice thing here is, I'm passionate about what I do, and I know Dr. Diane's passionate about what she does, but we're also both really scientific minded. I am really open to, the way I'm working, not working for everybody. I'm really open to that. I know that's the case because we're all different and we all require different things, but and Dr. Diane is experienced at researching, so she will also put her own personal prejudices aside and actually be able to hear you and record exactly what you let her know, and that is great feedback for both of us, and particularly for family constellations in general. Family constellations has been around since about the 1990s, developed by somebody called Bert Hellinger in Germany, an ex-Catholic priest, actually. And he was a larger-than-life character, and he came up with this whole idea of family constellations and how we could put, somebody to represent father, somebody to represent mother, somebody to represent the client in a room, and the client's watching, and you can watch out all of this energy and interaction from the sidelines. But then somebody else came forward called Dr. Ursula Frank, who was the first person who said, well, look, if we can do this in a workshop, we can do it in a one-on-one session. And she was the first person, to my knowledge, who brought in private sessions of family constellations. And then I started doing online family constellations through my husband, Stish, who came up with triangles, pieces of paper we could do it with online. And we started doing that in about 2005 or 6, I think. And then when COVID came, my whole practice went to online, and it didn't become a few sessions a week, it became my 100%. And I've been amazed at how well it works online too.
Sure. Mm-hmm. Experience too with finding it very useful online, and they feel a real sense of privacy when they're in their own home.
That's right.
And they can control their own environment. They feel less nervous.
And also, even the belief that I had before that, oh no, it can't work as well online as it does in person, which I did have that belief a long time ago, it's worked out to be totally untrue, because, and when I think about it, it shouldn't have been untrue because, you know, I know about energy, and so do you, Dr. Diane, right? And it's like, why should it be confined to only meeting with somebody in person? It's lovely to meet people in person and to really, you know, feel their physical presence, but actually energy's everywhere. So it doesn't really matter whether it's online or not, is what I tell people. And yes, they usually find out that's absolutely true.
And I think before COVID, people really didn't understand. I mean, yes, we have had the technology for years, and working in technology myself for many years, you know, I didn't understand why people where management was always so loath to let people work from home. You know, that they sort of have the bum and chair mentality that people aren't working unless they're at the office. So COVID really gave us a whole paradigm shift to working online, and I think the trust.
Yeah.
The trust that we can get results together working online, not necessarily being in person. So, yeah.
Okay, so very exciting.
May I just say a few things about, let's see, I just wanted to say, how people can register?
Yes, definitely.
Yes. Okay, so people can register their interest on my website, which is Core Insights. And this will be in the show notes too, I'm assuming. Yeah, so, Core Insights Institute. And I have a page for participation in research. You can read, I have a whole list of FAQs, and you can submit your interest, and we'll get right back to you with an eligibility form. It won't be suitable for everybody, but there are, you know, for most people, you're crazy normal, Yildiz. Most people will be eligible for this study. We are putting a cap around people who've had individual constellations within the last 12 months, because as practitioners, we believe that the process continues to percolate for up to 12 months, sometimes longer. But we think that that's a good cap to say, well, we can get the impact of this unique family constellation session. So in research, we have things called control measures, and this is one of our control measures.
Yeah. Okay. Fabulous. So you can contact me if you want to through my website, but I will pass you straight through to Dr. Diane. Okay. And that's fine. So it's Core Insights
Institute.
INSIGHTS.
Institute.com.
Yeah. Okay.
I'm going to send you all the information so you can pass it along to your group and all the people that you work with. Yildiz, I look so forward to having you on board with this research. You're instrumental to what we're trying to accomplish in the scientific community. So much appreciation to you, and all the researchers on this team are working for no compensation. And so we're extremely, extremely grateful. This has been a self-funded research study, but it will make a huge contribution in the psychotherapeutic space.
Yes, absolutely. And it's so interesting that in my last book, Let's Take the Crap Out of Psychotherapy, I did say in one chapter, you know, how do I know that the way I'm working is working? And I said, I don't know, except that my clients tell me it works. But I'm really open to somebody coming forward who would love to do some research on this work. And here is Diane, you know, it's like, wow, you know, how lucky am I? So I've certainly had a wish come true, you know, whichever way it goes, to be honest. I'm not even addicted to whichever way it goes, but just to have some actual statistics will be incredibly helpful to other family constellations practitioners, but also to the public. I know that a lot of the time when I've been training family constellations practitioners, they've often come back to me in frustration and saying, but nobody knows what it is, right? And people say, oh, it's that funny stuff and all this kind of stuff. Well, no, we actually want some statistics now so that we can put some figures where our enthusiasm is or not, right? I am open to the or not, because
that's right. We need to know what this does, and it just hasn't been enough research to say, well, what does this do?
Yeah.
And some of the, a lot of the research has been very positive, but there is not enough of it.
That's
so
right.
every little contribution we can make tells us more about what it is, what it does, who it's working for, who it's not working for, and who we need to protect. So it is a it is a public health issue, because there are practitioners who are out there who aren't necessarily as qualified as others.
Yeah.
And, as with all modalities, we do need to have a level of protection for public safety.
Yeah. Yeah. Okay. Well, thank you very much, Dr. Diane. And I will put all of your information in your notes so people can get hold of you, or they can come through me and I'll pass them on. Okay.
Right. Well, thank you so much for having me, Yildiz, and I look forward to our research together.
Thank you very much. So, anyone who wants to be involved in this research, please contact me directly, yildiz@yildizsethi.com, or Diane at coreinsights.com.au, and those notes will be in the writing underneath the podcast. So, another crazy normal completed. So, hope you found that interesting. You can find out more about me and what I offer at rapidcorehealing.com, or contact me at yildiz@yildizsethi.com.